Welcome once again to the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen, Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. So today we continue our conversations related to the COVID-19 pandemic. And remember, if you have questions, feel free to send them by WhatsApp to 620-6275 or send us an email at docandcovid@gmail.com. Today we'll be looking at two questions sent in by a viewer just like yourself. And these questions are very practical because it happens in many households who would have had a person testing positive for COVID or having symptoms. As usual, I'm starting off by wearing my mask to show you how to cover both the nose and the mouth, which is the correct way, but I'm alone as I am doing this recording. So I will take it off since I pose no threat to anyone around me and no one here is posing a threat to me. So here is the first question. Can COVID be transmitted through intimate contact? And intimate contact is sexual intercourse or by sexual activity. And here is the fact. All close contact, close as defined within 6 feet or 2 meters, all close contact with an infected person can expose you to the virus that causes corona disease or COVID-19, whether you're engaged in intimate activity or not. So any close contact, especially if it's for 10 to 15 minutes or more with a person who is infected by the coronavirus or the COVID-19 virus, puts you at risk. It does not necessarily have to be intimate activity or sexual intercourse. Just the presence next to such a person can put you at risk. So let us look at intimacy and COVID. The virus actually spreads by respiratory droplets, and these are released when someone with the virus coughs, sneezes, or even talks. The droplets can be inhaled or land on the face or in the mouth or on the nose of a person nearby, and that can cause an infection to start in that person. Coming into contact with a person's saliva through kissing or other intimate activities could expose someone to the virus. People who have COVID-19 could also spread respiratory droplets onto the skin and personal belongings such as clothing or telephone to others who would have been exposed to them. So that's important to know. In addition, the COVID-19 virus can spread through contact with feces. In fact, there's been documented presence of RNA particle in feces of persons who are in the late stages or even after recovery from this condition. It is possible that you could get the COVID-19 virus from intimate activities that expose you to fecal matter. And that's very, very well known. So I mentioned before about coughing and sneezing and even talking. And let us look at how quickly the germs can spread in 3 specific scenarios. Just by taking a breath, by having a cough, or by sneezing. So let's look at the first one. When you breathe, an infected person, a single breath can release up to 5,000 droplets, which have the infected material. Most of these droplets are low velocity, that means they move with low speed and can fall to the ground quickly. There are even fewer droplets that are released when you breathe through the nose versus when you breathe through the mouth. There are some persons who are more comfortable and more accustomed to breathing through their mouths, and those persons pose a higher risk to others around them if they're doing mouth breathing and if they are actually infected with the COVID-19 virus. A cough can release up to 3,000 droplets, which can travel at speeds of up to 50 miles per hour. Most droplets are actually large and can fall quickly to the floor or the ground, but many can stay in the air and can travel across a room in a few seconds. So it can actually travel more than the usual 6 feet or 2 meters that we consider a safe distance barrier between persons in the COVID-19 infection control measures. What about a sneeze? A single sneeze can release about 30,000 droplets, with the droplets traveling at fantastic speeds of up to 200 miles per hour. Most droplets are small and can travel easily across the room, and so therefore that 2 meter or 6 feet distance again can become overcome by the speed and the traveling of these droplets from a sneeze. So the best way to protect others and the best way to protect yourself is to wear your mask. And be careful when you're around persons, especially who are coughing, sneezing, or mouth breathing. It is very important to keep your mask on. Body fluids are important as well when discussing intimate transmission or possibility of transmission of COVID-19 through intimate contact. And let us see what the evidence says. There is currently no evidence that the COVID-19 virus is transmitted through semen or vaginal fluids, but the virus has been detected in semen of men who have or are recovering from the virus. It has been located and replicated. However, the importance or the clinical significance is not yet known, and there are no reported cases of transmission through these types of body fluids. Obviously, there's a lot more research that is needed for us to make a definitive conclusion on this particular question, but it is important to know that the virus has been found in the semen of men who are positive. How do we actually minimize the risk in these scenarios? The recommendations, like many other diseases that are transmitted by or potentially transmitted by intimate contact, is to minimize the number of intimate partners during this time, to avoid intimate partners who have symptoms of COVID-19, and some controversial ones or difficult to contemplate, to avoid kissing, to avoid intimate behaviors that have a risk of fecal oral transmission or that involves semen or urine. Using barrier contraception such as condoms. Wear a mask during intimate activity. I remember when this suggestion first came out of Europe, there was a lot of skepticism, but the recommendation still holds. Wash your hands and shower before and after intimate activity. Use soap or alcohol wipes to clean the area where you have intimate activity, whether it's on the bed or etc. So hopefully that answers the specific question about the transmission of COVID-19 through intimate activity or sexual intercourse. Let us look at the second question that came. I tested positive, but I need to look after my 12-year-old child. What can I do? Very important, practical question. Many homes may have both infected parents, or in a single parent home, they may have the parent becoming infected. Thankfully, the disease itself has not been as devastating in children as it has been in the older population and the elderly group. Children generally tend to have very mild symptoms, and the majority will recover. And at least that's what we know for the immediate and intermediary term. We do not know yet about long-term effects of COVID on children, but it's important to know that when children get this infection, that the symptoms are actually quite mild and children recover. In fact, only about 7.5, 7.3% of all cases that have been documented are seen in children. What you need to do to prevent spread from adults to children is the same thing that you need to do to prevent spread from one person to the other. Washing of hands. This is very important for you to do that for about 20 seconds, to wash thoroughly the front and the back of the hand, the fingertips, etc. If you have to cough or sneeze, make sure you use a tissue which is disposed of immediately. And wear a mask when around others. Wear a mask especially when you're around the vulnerable population, such as the elderly and those with comorbid conditions. Avoid touching your face, because oftentimes, unknowingly, the virus or droplets and other infected particles can linger on your hands, your fingers, etc. And you can touch yourself, touch your others around you, touch the child, and this can cause transmission. So it's important to avoid that excessive touching and wash your hands carefully. The child should be tested, because remember, the child is in the house with a known positive person. But generally, we test children when they develop symptoms, or if they develop symptoms. But there would be no harm in testing this 12-year-old child or the older child. The safe practice should always be adhered to and always be practiced, which is to quarantine at home, to wear masks, gloves whenever possible, and to support your immune system by eating the right foods and having the right nutritional support. We've talked extensively about vitamin C and zinc and vitamin D3 especially. These can help to boost the immune system. And although there are no specific compelling scientific evidence that says, oh, this prevents it, it is still a useful thing. It doesn't cause any harm. And we encourage that you use these things to boost your immune system during this COVID-19 pandemic. It can also help children to boost their own immune system to fight off this if they are exposed. Monitor the children for symptoms, specifically fever and coughing and sore throat or runny nose. And things that you can do, simple things like avoid sharing utensils like cups and plates, etc. These are all things that you can do to help protect children from potential exposure. And of course, wash clothing thoroughly, and wherever possible, wash them separately, because it can help in preventing transmission from an infected person to another. So, how do we protect our families from this COVID-19 pandemic? You have to actually screen people who are going to be coming in the house. Caregivers of children, for example, you have to screen them for things like fever, cough, shortness of breath, etc. If caregivers and children become sick, you have to keep them at home and ensure that children and caregivers wash their hands very regularly and sanitize very regularly. Caring for children with special needs during COVID is no different generally from caring for children without special needs. There are no increased complications in these special needs kids, except and if they have pre-existing conditions such as pulmonary disease or diseases that affect the lungs, or if they have other comorbid conditions such as diabetes, heart disease, obesity, or malnutrition. To avoid hand-to-mouth transmission, ensure minimal contact with mouth elements like pointers, straw, or digital tablets. Wash hands before and after wiping saliva, and assist frequently with hand hygiene. So I hope this would have answered both questions that we have looked at today, one with intimate transmission and the other with caring for children by an infected parent. Remember, if you have questions, send us a WhatsApp message to 620-6275 or send an email to docandcovet@gmail.com. Thank you again for joining us.